Medications and substances that are generally advised to be avoided or used with caution during the second trimester of pregnancy. 1. Non-steroidal anti-inflammatory drugs. NSAIDs such as ibuprofen, Advil, Motrin, and naproxen Aleve, especially after 30 weeks. Risks include premature closure of the ductus arteriosus, a vital blood vessel in the fetal heart that typically closes after birth. Oligohydramnios, low amniotic fluid levels, which can lead to complications such as fetal lung underdevelopment and deformities. Fetal renal impairment, potential kidney problems in the fetus due to decreased blood flow and oxygenation. 2. Tetracyclines. Antibiotics like doxycycline can affect bone growth. Tetracyclines bind to calcium ions in teeth and bones, potentially inhibiting growth and causing discoloration. Cause tooth discoloration, permanent yellowing or graying of teeth due to the incorporation of tetracycline into developing teeth. 3. Aminoglycosides. These antibiotics, such as gentamicin, can potentially cause hearing loss. Aminoglycosides can damage the inner ear structures responsible for hearing and balance, lead to kidney damage. Potential nephrotoxic effects can impact fetal kidney function. 4. Certain anticonvulsants. Valproate, associated with a higher risk of birth defects such as neural tube defects, heart defects, and craniofacial abnormalities. Developmental delays, potential long-term cognitive and developmental issues. Lower IQ, exposure to valproate in utero may result in lower cognitive function in children. Carbamazepine can cause neural tube defects. Similar to valproate, there's an increased risk of spinal cord and brain defects. Other developmental issues, potential for cognitive and developmental delays. Phenytoin may lead to birth defects, including heart defects, and cleft palate. Developmental delays, potential impact on cognitive and motor development. 5. ACE inhibitors and ARBs, used for high blood pressure. These can cause fetal kidney damage by reducing blood flow to the fetal kidneys, potentially leading to renal failure. Lead to oligohydramnios, decreased amniotic fluid levels due to decreased fetal urine production. Increase the risk of other complications, such as fetal growth restriction and preterm birth. 6. Certain antidepressants. Selective serotonin reuptake inhibitors, SSRIs. While some SSRIs are considered relatively safe, others like paroxetine may carry risks, including birth defects, potential increased risk of heart defects. Neonatal abstinence syndrome, NAS, withdrawal symptoms in newborns exposed to SSRIs in utero. Tricyclic antidepressants, TCAs, may pose risks, especially if used near term, including NAS, similar withdrawal symptoms as with SSRIs. Other withdrawal symptoms in newborns, potential for jitteriness, irritability, and seizures. 7. Antineoplastic agents. Chemotherapy drugs can be harmful to the developing fetus, potentially causing birth defects, various congenital anomalies depending on the specific drug and gestational age. Growth restriction, reduced fetal growth due to the impact on rapidly dividing cells. Other developmental issues, potential long-term effects on cognitive and physical development. 8. Certain antithyroid medications. Methimazole can cause fetal thyroid problems, potential for hypothyroidism or goiter in the fetus. Other complications, such as aplasia cutis congenita, a rare skin condition. Propylthiouracil, PTU. While sometimes used in the first trimester, it's also associated with risks, including liver damage, rare but serious risk of hepatotoxicity. 9. Opioids and narcotics can cause neonatal abstinence syndrome, NAS. Withdrawal symptoms in newborns exposed to opioids in utero may lead to other complications, including preterm birth, low birth weight, and potential long-term developmental issues. 10. Certain over-the-counter medications. Pseudoephedrine and phenylephrine. Decongestants that should be used cautiously and under medical guidance due to potential effects on fetal development. Cough and cold medications. Many contain ingredients not well studied in pregnancy, such as dextromethorphan, cough suppressant. Potential risks include developmental issues, though data is limited. Guaifenesin, expectorant. While generally considered safe, there's limited data on its use during pregnancy. 11. Herbal supplements. Many are not well studied in pregnancy and can pose unknown risks, including 1. Ginkgo biloba may affect blood clotting and interact with other medications. 2. St. John's wort can interact with other medications, including antidepressants, and affect fetal development. 3. Ginseng may affect blood sugar levels and blood pressure and interact with other medications. 4. Kava can cause liver damage and interact with other medications. 5. Yohimbine may cause high blood pressure and interact with other medications. 6. Licorice root. High consumption may lead to preterm labor and other complications. 7. Donkey may stimulate the uterus and cause contractions. 8. Blue cohosh may cause uterine contractions and affect fetal development. Why be cautious with herbal supplements? 1. Lack of regulation. Herbal supplements are not strictly regulated and their safety and efficacy may not be well established. 2. Potential interactions. Herbal supplements can interact with other medications, including prescription and over-the-counter drugs. 3. Unknown effects on fetal development. The impact of many herbal supplements on fetal development is not well understood. What to do? 1. Consult your healthcare provider. Before taking any herbal supplements, discuss the potential risks and benefits with your healthcare provider. 2. Choose reputable sources. If you do decide to take herbal supplements, choose products from reputable manufacturers that adhere to good manufacturing practices, GMPs. 3. Monitor your body. Pay attention to any changes in your body or symptoms that may be related to the supplement. By being informed and cautious, you can make the best decisions for your health and the health of your baby. Please like this video and subscribe to this channel at BBFMO. BBFMO. Your health, our priority.